Mr. H had surgery, it was probably about a year ago now, right?
A little over a year, about 13
over a
months.
year. He had a lumbar fusion for back and radiating leg pain, and has done well. And what brings you back?
Just a follow-up. I wanted to come here after a year. I did start back going to the gym in January.
Good. Good. How's that going?
I had done the treadmill
Right.
for like 6 months, and then I worked my way into the gym.
Right.
It's going fine. It was kind of more about the pain that I get occasionally.
Okay.
So I didn't know if that was a problem, anything I should be worried about in terms of warning signs.
Okay.
Pain.
All totally legitimate, valid concerns.
It doesn't stay though. I mean,
Okay.
sleep on it goes away.
If I remember correctly, you were having like excruciating, like right thigh pain when you were walking. Is that what it was? Tell just for Satya's sake what your symptoms were before the surgery.
Yeah, Satya had a pinched nerve between L3 and L4, and it would create pain across my lower back and down across my thigh, and completely painful to walk across the parking lot.
Yes. Yeah.
It's certainly more painful to walk across the parking lot and back.
Right. And you love exercise and you stay fit and you wanted to get back to that.
Yeah. Couldn't do that before the surgery.
Good. So you're back with that, but you have pain in your back after you work out in the gym. Is that every
a little bit
time?
in the surgical area,
Okay.
right there, not the nerve pain at all.
Okay.
So
Show me, just kind of turn around and point to where it is.
just right here.
Okay, where your incision was. Okay.
Yeah.
Is it tender to the touch here?
Nope.
And the strength is good?
The strength is getting a lot better.
Okay.
Yeah. It's
Okay.
it's not like it was a year before the surgery,
Right.
but it is a whole lot better in terms of everything else I was doing, chest, arms. That's all coming back.
All right, so I just want to make sure
Bicycling,
you're doing that okay?
Yeah, running, all of that was just come back. That's great.
All right, excellent. So are there particular exercises that cause you to have more pain when you get home from the gym, or is it just the general workout?
Probably a little bit more on the preacher bench.
Okay, like curls and
Yeah.
things like that?
Yeah.
So that seems to give you a little bit more stress on your
Right.
back.
Because I'm not really doing anything free weights in terms of chest. It's just on the machines.
Right.
So there's a lot of support back there and not a whole lot of weight. But probably the most is the preacher bench.
Okay. So,
No.
good. So, I mean, I'd say you're doing extremely well 1 year post lumbar fusion. So, I would say that nothing to worry about at all. I would say do the exercises that you love doing. If you really love doing preacher curls, then go ahead and do them and ramp them up.
Okay.
If you can find a different way to do them, standing curls or anything that might change that dynamic, a machine-based exercise to work on your biceps, go for it.
Yeah.
But if you love running and biking, I want you to do it.
Would core help? Would core help my back?
Absolutely,
Yeah.
yeah. So planks would probably be the
Yeah.
best exercise you could do.
Yeah.
Front planks and side planks.
Stop doing this.
Yeah,
So,
yeah.
okay.
That would be very good.
Okay.
For swimming is always a good exercise to get in at our age, and I think we're close to each other. Swimming is much more atraumatic. It's a great calorie burner, so consider that as like something new to try in your training regimen. Just like your wardrobe changes, your exercise regimen changes too. Running, probably not the greatest long-term exercise, but if you love doing it, do it. You have no restrictions, but I would, just tailor the exercises to your back. So I wouldn't do good mornings. I wouldn't do deadlifts or power cleans because that's going to really strain that. Well, I like the way you're ramping. I like the word ramping. If you're doing it slowly and gradually, it's absolutely fine. Okay?
That's it.
Good. I'm here for you if you need me.
Okay.
All right?
All right. Thank you.
Great to see you.